Our next test is the Thomas test, so looking at biomechanics alignment through the lower limb, as well as hip flexor and quad tightness, as well as your TFL and ITB. So getting your client to sit right on the edge of your bed, just your glutes touching. You're going to ask your client to hug one knee for me, please, and then slowly help them lower themselves down onto the bed, letting their right leg go floppy and relaxed. So from here, we want to go to the top of their patella. Should be in line with the top of their hip. So looking at the iliac crest. I'll go this way. We're nice and in line here, so we have zero lateral pull, which is good. So that means that we're nice and aligned. If Courtney's leg was slightly out towards the side, we take the centimetres away from that midline. So in this position, Courtney would be about a centimetre outside of her midline, which would mean that her ITB and TFL is a little bit tighter, pulling that knee out. At the moment, Courtney's good and she's nice and in line, which is good. Testing whether hip flexor is tight, having a look at where their iliac crest is, and seeing whether their knee and kneecap is lower than that point. So at the moment, we're kind of very neutral. If you push down and there's a bit of a spring back, that can also indicate a little bit of tightness, and they can also tell you whether that feels quite tight. Does that feel tight, Courtney? Yes. That's quite tight. Yes, there is a bit springy. That's okay. So from now, she is nice and in line, so it's neutral lateral pull, but a little bit of quad tightness. If you get the client to straighten their leg, again, this is more psoas tightness. So you can see whether it becomes positive, so above that midline. So at the moment, her psoas is a little bit tight. Again, you can ask your client, does that feel tight? It does. Beautiful. And relax. Right, in the relaxed position again, you can start to bend their knee and ask them whether there's any tightness through their quad. Any tightness? There is tightness through the lateral part of her quad. And relax. So that's the end. So here we have neutral alignment, we have hip flexor tightness, psoas tightness, and that lateral quad loading as well. After the test, help your client sit back up. 1, 2, 3, and done.